Lee will provide the first discussion, resuscitation of poor-grade subarachnoid hemorrhage. Kiwon.
All right. Good afternoon, everybody. How long do I have? It's, I think, 7.5 minutes, right? Yes. 6.9 minutes. So I've never given a 6.9-minute talk, but at least the topic is something that I talk about all day long, every single day. So I think I can do this probably pretty quickly. I was asked to talk about, thanks to the organizers, I was asked to talk about resuscitation of poor-grade subarachnoid hemorrhage. Before we talk about the latest medical literature and hypothermia for cooling ICP and all kinds of fun stuff, I think that this article at least deserves your quick attention. I'll spend maybe 10 seconds on it. Published in Green Journal 10 years ago, how withdrawal of support in ICH overall may lead to self-fulfilling prophecies. Basically talking about all supratentorial ICH patients were looked at, and they wanted to see what kind of impact it would have, whether or not the practitioners in the beginning, when they first arrive at the door, their attitude, their prognostication will actually impact the long-term outcome. So this has nothing to do with medicine. It's just basically looking at the attitude by survey. Okay, did you have an attitude? Did you think that patient was going to survive, or did you think that patient was not going to survive? And they kind of found out how the practitioners tend to have overly pessimistic prognosticating pessimistic view, and that actually had a lot to do with the overall prognosis, because they tend to withdraw. You know, this notion of, oh, patient presents in coma, grade 5 subarachnoid, put the ventricular drain in, you're still in coma. They have to do very, very bad. Well, most of them do, but not everybody does. Tell you a little bit about that. Their data actually show that individual patients in traditionally poor outcome, gotta watch myself, poor outcome categories can actually have a reasonable neurologic outcome when treated aggressively. It turns out the most important prognostic variable is not how long they had an ICP crisis or anything like that. It's actually the level of medical support. Makes a lot of intuitive sense. So just want to tell you about that, and then highlight what we do at Columbia Neuro ICU in terms of multimodality monitoring. We think that when people with a high-grade subarachnoid hemorrhage come in, there's not much to